Receiving a diabetes diagnosis can feel shocking or overwhelming. The illness has some serious potential complications such as blindness and amputation. It's the 7th leading cause of death in Africa. Treatment often requires immediate and significant lifestyle adjustments. However, with careful management, you can still enjoy a varied diet and active lifestyle. There are plenty of people out there who refuse to let diabetes stop them from thriving. If you are seeking some inspiration or information, look no further. Health and Flavour educates you on different lifestyle diseases and how you can manage them at home. My name is Joan Omambia.
I think people drink a lot of juices. For those that know, they do juice.
You see, it is upon you, it is yourself, it is your body. You need to know how to take care of it. You can take a quick cucumber, but this is coconut milk, fresh from the coconut, this one.
9 out of 10 people don't know they have it. Healthy lifestyle choices can help you prevent diabetes.
So what really is diabetes? It is a chronic incurable disease that occurs when the body doesn't produce any or enough insulin, leading to an excess of sugar in the blood. Insulin is a hormone produced by the pancreas which helps the cells of the body use the glucose in food. Cells need this energy in order to function properly. Sugar builds up in the bloodstream and is excreted in the urine. We set out to the streets of Nairobi to find out what people know about diabetes, and this is what we gathered.
Exercise, not taking too much sugar. Yes, I think that's the only thing I know.
I think avoiding eating too much sugar can be one of the remedies. Yeah, like you can take less sugary foods. Yeah, and maybe you cannot take soda all the time, or you cannot take a tea with too much sugar. Yeah, I think that can be remedy to diabetes. Yeah.
Thank you.
Yeah, diabetes is something to do with the lack of sugar, imbalance of sugar in the body. I think people drink a lot of juices. For those that know, they do juice. And some, they use some medicine. They are recommended to take every day.
Okay.
Yeah, and reducing pressure in your life.
Okay.
Yeah.
A healthy diet plays a huge role in managing diabetes. Hesperance Deodate, our nutritionist, shares insights into superfoods that help keep diabetes in check. Ms. Hesperance says these superfoods will help you regulate glucose levels and lower insulin levels. One such superfood is the moringa leaf. Studies have indicated it lowers blood sugar levels up to 29%. Why not give her diabetes-busting smoothie recipe a try?
There are 3 types of diabetes that we'll discuss today, and the first one is type 1 diabetes mellitus. This one is resulting from the failure of the pancreas to produce enough insulin due to loss of beta cells. Okay? It was referred as the insulin-dependent diabetes mellitus or juvenile diabetes. And then the second type is type 2. Type 2 diabetes mellitus begin with insulin resistance, a condition in which cells fail to respond to the insulin properly. Now, in this type 2 diabetes, when the disease is progressing, then there will be lack of insulin, which will also come into more complication. Now, this form was previously referred to as non-insulin dependent diabetes mellitus or adult onset diabetes. Then the third type of diabetes that we'll discuss today is called gestational diabetes. This is the third main form and occurs only when pregnant women without any prior history of diabetes develop high blood sugar level. Now, we'll go through these signs quickly. The signs and symptoms will be weight loss, increased urination, increased thirsty, increased hunger, blurred vision, headache, fatigue, slow healing of wounds, itchy skin, and sometimes there will be emergencies. There are some emergencies that will happen. If this person knows that he's diabetic, then he'll be able to respond because of the signs. He'll be able to tell that now with this sign, then probably my sugar level is going down, or with this sign, probably my sugar level is going up. So my dear viewers, it is good for you to know yourself. It is good for you to know the signs. Cram them, feel them, make sure that you are able to identify which one is which when the sugar is going low, or which one is which when the sugar is going up. All right? Now, in these emergencies, sometimes when the blood sugar is going low, there will be feeling of uneasiness, sweating, trembling, increased appetite, sometimes confusion, aggressiveness, and in the progressive way, drunkenness, seizure, rapid breathing, sweating, cold, pale skin, and if you do not watch out, unconsciousness, brain damage, and then death. Why? Because sugar is supposed to be constant in the blood. When it drops so much, then the brain cannot function, so it will lead into death. Now, mild to moderate cases of low blood sugar will be taken care by yourself, because if you know these symptoms, then you will know that my sugar is a little bit low, and they normally walk around with sweets, or they will take a certain drink, and they will have sorted out the problem. But in the severe cases, this unconsciousness, then something has to be done, and this patient has to be rushed to the hospital. There are some complications of diabetes. Now, all forms of diabetes increase the risk of long-term complications, all of them. Now, this will develop after many years. Now, complications could be like the damage to blood vessels, which will lead into damage to the eye, kidney, and nerves, sometimes cardiovascular disease or coronary artery disease, okay? And so there will be some complications. There might be complications to your eyes. Now, when your eyes are damaged, now this kind is called now the diabetic retinopathy. It means it is channeled, it has channeled itself to your eyes, and it will cause more damage to blood vessels of the retina of the eye. Now, these complications will gradually lose the vision. It may lead to blindness, but it only happens when the blood sugar is high and it is uncontrolled. You are not able to keep it where it is supposed to. Although you have been told that you are diabetic, you must have been told that you are supposed, there are some things that you have been told to make sure that your blood sugar is normal, yeah? Through medication, through a lot of ways. So if persistently it is not normal and yet you are diabetic, it will complicate your eyes. And now the diabetic increases the risk of having glaucoma, cataracts, and other eye problems. Now, when it has channeled itself to the kidneys, it is still longer. I mean, the blood glucose is high for a long time. Then that kind of diabetes, we will term it as diabetic nephropathy. It means it is channeled itself to the kidneys. Now, this will lead again into the complications of the kidney, tissue scarring, urine protein loss, and chronic kidney disease. Sometimes you may end up being dialyzed or in kidney transplantation. Now, when the damage has gone to the nerves, now this kind of diabetes will be referred as the diabetic neuropathy. Now, with this one will come with numbness, either the fingers, the legs, you see, the tingling, pain, and sometimes even the muscles will be painful, foot ulcers, it will lead to amputation. And you know, this one comes with very, severe pain and weakness to the muscles. And so this thing is truly very bad. Now, when diabetes is I mean, the blood glucose is prolonged high in the blood, it will also affect your brain. And there will be loss of cognitive functions, depression, irritability, anxiety, loss of concentration, and yes, there will be some problems. What are the causes of this diabetes? In type 1, it is only because the beta cells are not able to produce insulin. And so there will be insulin deficiency. And this is an autoimmune disorder whereby the immune system, the cells of the immune system are somehow confused. Let me put it this way. And they are not able to recognize the beta cells in the pancreatic cells. So instead of protecting the cells, now they are attacking them. It is like you have a dog in the house and somehow this dog is confused. Instead of taking care of the children of the house, it is biting them. So when that happens, it is an internal problem, your own dog, your own children. But yes, when it happens, then you have this, the immune system biting, attacking the beta cells, which are supposed to produce this insulin. When that happens, then there will be no beta cells, and so there will be no insulin, and there will be rising in this blood sugar. In type 2 diabetes, resistance. There might be resistance. The insulin is there, is producing that hormone. The hormone is being produced, but there is the resistance. It is not probably the quality that is supposed to be, or the amount is low, okay? Now this is a lifestyle factor. Now in type 2 diabetes again, major problems will be obesity, lack of physical activity, poor diet, refined foods and snacking with sugary food, and we see stress again, and we see this business of taking whatever is available, the body does not want. And in gestational diabetes, the signs resembles, and the causes resembles, again, those ones of type 2 diabetes. How do we prevent? How do we prevent? We just have to learn how to prepare a healthy diet. Healthy diet in prevention: exercise, normal body weight, quitting smoking and drinking alcohol. Avoid red meat and saturated fat. Avoid refined foods. But in management, I want to prepare a quick meal for you because you are already diabetic and you know that you are diabetic. I want to serve you. It could be your lunch, or it could be your lunch, it could be your supper. I will give you a quick one, and especially if you know that probably you have tested yourself now and your blood sugar is high and probably even much higher, this is how I will help you to lower it down. Use the cruciferous vegetables, broccoli and cauliflower, which have low amount of starch, but the starch is here. Use it with your vegetable salad. If you use it with your vegetable salad and you use this broccoli, cauliflower as a form to stand before, instead of your starch, and then you eat it this way, and you have your food like this, you do not have any other. After eating this meal, then half an hour, then go test yourself. Another half an hour, test yourself. Another half an hour, go ahead and do it. Let me tell you, you will see it going down, and this way you will be able to manage it. When it is very high, limit the amount of carbohydrates that you are taking and take the alternative carbohydrates that is found in cruciferous. But there's another way to take it really quickly down, but naturally, okay? You know these pawpaw leaves? These ones are very excellent. These ones are good. You know the meaning of good when it comes to diabetes? Use this one. Just take a leaf or two, big ones, blend them, and then drink. You can sieve and drink that juice, and then start watching how it goes. And you'll see naturally, you will see it going down. And if you are diabetic, at least 3 times, 3 days, consecutive days in a week, you can be taking fresh pawpaw leaves juice in the morning, and by doing that, you will be making your blood conducive for the insulin to be produced in a very good way. But if you have weight problems, you have to lose weight. And if you are on medication, make sure that you use your medication properly. I also want to give you another quick one. If you are diabetic and you want to manage it, make sure that you love yourself. Love yourself, say no to a lot of those complications. Do not allow yourself to lose your sight. Do not allow yourself to lose the feelings because of numbness. Let me tell you, do not allow it to go to the kidney. Don't allow it. Yeah, and you can do it. This is something that you can do. Do not allow the sugar levels to go higher to 2 digits. Do not allow that. And do not allow amputation. There are some conditions that will be put on them. They will be set on them. The conditions that will be taught, will be trained. Things that you are not supposed to do. Just make sure that your lifestyle agrees. Yeah? When that happens, then you're okay. There is another thing that you can do. Cinnamon. Use cinnamon generously. And let me show you. The same way you used to use sugar, then make sure that you use it generously. How will you do that? This is cinnamon powder. And with this cinnamon powder, this is what you will do. I will take probably a spoon or 2, okay? Because by itself, it is sensitizing the uptake of the little insulin that is available. So I'm using it generously, not as a spice, but like sugar. And this is what I will do. I want to take a raw banana, green banana, green. I mean green banana, like this one. I have this one that is already peeled. I'll remove it in water. And I just want to prepare a quick meal. And don't ask me where fire is. We are going to finish this business right now. And if your sugar level is high, then you will take it down. You see, it is upon you, it is yourself, it is your body. You need to know how to take care of it. You can take a quick cucumber, but this is coconut milk, fresh from the coconut, this one. So with this one, then make sure that you have this coconut milk, you've added it there. And what green leaves do you have? I have lettuce here. I use what is available. Yeah, I do not complicate. It is not a must that I go to a specific one. It is only what is available. Assume that your blood sugar is in 2 digits and you want to take it down, all right? This is what you are doing. I'm taking all the greens that are available here. And I will also add something else. The food is nice. It is good. It is not that when you are diabetic, then you are supposed to eat something that is not sweet. And I'm adding some avocados. Yeah? You can also tell that this food is going to be very good. Okay? Now with this, I want to add some more coconut milk. And I'll blend it. Do you remember the cinnamon? Cinnamon is sweet, and I've put it generously. Okay? All right? There you go. Done. And you know what? This food is very ready. There was a raw green banana. Okay? There was a green banana. I want to show you. These things, we have them. This is food. It is not a drink. You eat this one, you are full. See? See the consistency? and see what it has. You can, if you had cashew nuts, you would have been able to add some cashew nuts. But what I'm trying to tell you is, if it is in 2 digits, as you are avoiding cooked food, or as you are avoiding the carbohydrates, just make sure that you eat something that is balanced. But there are some food particles which have fiber, and they are able to capture, to take that excess glucose in the blood. So this is one of them. And if you ate this one, let me tell you, just after a few minutes, check your blood sugar. Just check it, and you'll see it will go down. If you have aloe vera plant, take those leaves, cut it in water. You can also take the content, the jelly, put it in water, drink it, then you are there. You can also do therapeutic massage. Exercise is a must. I do not know how to stress it. If you exercise, let me tell you, use that excess sugar. Use it. Use the excess energy. Manage your stress very well. You can manage your sugar in a manner that it will not complicate anything. But if you do not manage it, then the complications are many, and complications are from your head to toes. It will ruin you, it will ruin your eyes, it will ruin your heart, it will ruin your kidneys, it will ruin everything, your reproductive system. It is going to ruin you. It will ruin your skin, it will ruin your immune system. But if you are able to control diabetes, let me tell you, you are you. You are a normal person. You can take, you see these legumes? Take it with your salad. That's it. It is a meal, complete meal. If you want to take starch, just make sure that it is whole grain. Learn this art of eating your food raw, but also learn the art of combining some little seeds now with the raw food. By doing that, you are just doing things naturally. These are natural remedies that will bless you to be able to manage diabetes and also to help you prevent it. Exercise is a must, but therapeutic massage is also a must. And on top of that, therapeutic meals. Let us stay healthy by not using natural remedies, by making sure that we take care of ourselves in an amicable way that the body wants, but in a manner that we have been created to be well. Thank you very much, and be blessed, stay blessed.
Proper diabetes care includes much more than insulin injections. It's a serious disease with potentially serious complications if you don't take good care of yourself. The World Health Organization's report of an alarming surge in diabetes cases estimates that 422 million people around the world live with diabetes. The rates are 4 times higher than levels 40 years ago, especially in developing countries. They estimate that 3.7 million people die from diabetes-related issues each year. But how can you prevent yourself from getting diabetes? Dr. Fesaya Tsagai, a public health specialist, is here to give you tips on how to keep your blood sugar at a healthy level.
Having heard from the doctor, fitness expert, and the nutritionist, you don't have to deal with conflicting message about what to do and what to eat and how to live in order to keep diabetes under control. I am Dr. Fesaya Tsagai, a general surgeon, a public health specialist. Let me add a nugget or two on the subject of today, diabetes mellitus. Diabetes is a condition that affects the ability of the body to use blood sugar for energy. Type 2 diabetes is the most common form of diabetes. 9 out of 10 people don't know they have it. Healthy lifestyle choices can help you prevent diabetes. It is particularly important to make diabetes prevention a priority if you are at increased risk of diabetes, such as if you are overweight or you have a family history of the disease. Number 1, do this. Physical activity takes some glucose out of the blood to provide energy during and after exercise. This lowers blood glucose levels Exercise helps you control weight, uses up glucose as energy, and makes cells more sensitive to insulin. Number 2, if you are overweight, diabetes prevention may hinge on weight loss. Every kilo you lose can improve your health, and regular exercise can help one to reduce the risk of developing diabetes by almost 60%. Number 3, excessive use of alcohol may cause chronic inflammation of the pancreas, which can impair its ability to secrete insulin and potentially lead to diabetes. My advice to you is stop taking alcohol if you are currently consuming alcohol. Number 4, stop smoking, since tobacco use can increase blood sugar levels and lead to insulin resistance. People who smoke heavily, more than 20 cigarettes a day, have almost double the risk of developing diabetes compared to people who don't smoke. Number 5, if you are more than 45 years old and your weight is normal, ask your doctor if diabetes testing is appropriate for you.
There you have it. Having diabetes doesn't mean you need to give up sports. Regular exercise helps you lose weight and increase insulin sensitivity. Increased insulin sensitivity means your cells are able to use the available sugar in your bloodstream. Exercise also helps your muscles use blood sugar for energy and muscle contraction. People take ownership of sickness and disease by saying things like my high blood pressure, my diabetes, my heart disease, my depression, my. Don't own it because it doesn't belong to you. Eat healthy. A low-carb lifestyle may even have implications for other diseases like cancer, and your wallet. My name is Joan Omambia. See you next time for another intriguing lesson on another lifestyle disease. Bye.